The CDC is calling for universal mask wearing in all activity outside your home as COVID-19 cases surge to dangerous levels. More than 227,000 new infections of coronavirus were reported in the U.S. on Friday alone. This week, 11 states broke records for new cases reported in a single day. According to Johns Hopkins, more than 279,000 Americans have died since the pandemic began. The U.S. has also surpassed 14 million confirmed cases of the virus. Our Michael George reports.
As bad as it is now, projections coming from the White House show the death toll could be more than 500,000 by March. The Center for Disease Control issued its strongest call yet for masks yesterday in an effort to control the airborne virus. And this week, 11 more states broke records for cases in a single day. 100,000 people are in U.S. hospitals, and with each day, fewer and fewer beds become available.
It's one giant ball of anxiety trying to figure out where the next patient's going to go.
Donovan Betcher is a respiratory therapist in Wisconsin. Mavic Jardis is a charge nurse there.
It is difficult. Nurses are the first person that our patients see, and nurses are the last person that they will see in their last breath.
The strain on healthcare workers is made worse by people who don't do their parts.
You look on social media, there's a lot of talk about healthcare heroes and all that. Well, if you really want to respect people in healthcare or anyone that has to work right now, stay home, wear a mask.
Take Thursday night's Young Republican Gala, reportedly held in New Jersey, with 150 mostly maskless attendees, and Congressman Matt Gaetz of Florida.
It is beyond the pale that anyone would willingly endanger people in another state, never mind their own.
An infuriated New Jersey Governor Phil Murphy shut down the venue and singled out the congressman.
He is not welcome. I hope you're watching, Matt. You are not welcome in New Jersey, and frankly, I don't ever want you back in this state.
California is also pulling back its welcome mat. Restaurants accept takeout. Bars, wineries, and salons will close in counties where intensive care beds are in short supply. Even attending private gatherings will be prohibited.
Because right after she gave birth, that's when they put the tube in.
As hard as orders like California's are on small businesses, officials are trying to avoid heartbreaking stories, like that of 33-year-old Erica Becerra. She was 8 months pregnant when she got sick.
We prayed for her. We talked to her. We comforted her till the last moments.
Doctors delivered her baby, but couldn't save her. For Michael George, New York.
For more on this, I want to bring in Matthew Fox. He's a professor of epidemiology and global health at Boston University. Mr. Fox, the Institute of Health Metrics and Evaluation found that COVID-19 was the leading cause of death in the U.S. this week. It killed more people than heart disease. What's your reaction to this and the numbers that we're seeing around the country?
It's truly staggering and incredibly unfortunate. This is a disease that we have means to reduce the amount of transmission, and we're not taking the steps that we really need to make sure that we are not overwhelming the healthcare system. So it's a real tragedy, and it's one that we could have certainly mitigated.
Health officials are saying that we're not even seeing a surge from Thanksgiving yet. Dr. Anthony Fauci actually warned of that Thanksgiving surge in 2 to 3 weeks. If we're seeing these numbers now, what is it going to look like in the future?
It's going to get worse. We are certainly in for a dark winter, as many have already pointed out. The number of cases that we're seeing continues to go up, and we can expect that with the holidays coming and the travel that's already happened around Thanksgiving and will continue to happen for Christmas is going to lead to increased number of cases. And even if we only see 1% of those who get infected going on to die, that's going to be over 2,000 Americans who are dying each day. It's a devastating amount.
The healthcare system has been hammered by this since the beginning. Are hospitals better prepared for this new surge than they were at the beginning of this pandemic? Better than February or March?
So there's no question that hospitals are far better prepared now than they were back in February and March, largely because We have a much better understanding of how to care for people with this disease. But as hospitals continue to fill up, it becomes harder and harder to provide that excellent care to people. And so in cases where hospitals are filling up, we can expect that the mortality in those hospitals is going to go up greater than it would have been if we were able to effectively care for all of those who needed it. And that is why stemming the amount of transmission is so important, because if hospitals are overwhelmed, mortality goes up, and those are preventable deaths.
The CDC has issued its strongest mask guidance yet, telling people to wear one in all activity outside of one's home. What do you make of this?
So this, I think, has been a long time coming. I think this is something we should have done months ago. We know that masks are effective at reducing the amount of transmission. It's not the only thing that we need to be doing, and masks alone won't stop all transmission. So the first thing we need to be doing is reducing the amount of contacts that we're having. But if we do need to be in contact with other people, particularly if we are indoors, we should be wearing masks. And remember that each infection that we prevents not only that infection, but all the people that the person that you passed it on to would also pass it on to. So anything that we can do to mitigate that transmission is going to help us in the long term, and masks are absolutely a part of that strategy.
And people are a little bit optimistic because there's 2 vaccines expected to be approved in the U.S. in the next few weeks. But the devil's in the details, and the details right now are logistics. How long will the average American have to wait to possibly get one of these vaccines?
So we don't know for sure exactly how long it's going to take. It's going to take some time to see exactly which vaccines get licensed first and what the cold chain requirements are for those different vaccines. But we can expect that some healthcare personnel will start to get vaccinated by the end of the year. And then I think for the average American, our best guess is that large-scale rollout of these vaccines will start to happen around April. And so by early summer, we can start to see real scale-up of vaccine distribution.
Scary next few weeks. Matthew Fox, thank you very much for your insight.
Thank you.